it's day 200 of our nationwide lockdown, and now the global pandemic has certainly resulted in a new way of doing things. Working from home for at least part of the work week has become commonplace. It's become a bit of a norm, but with workers now in the comfort of their own homes, does this actually give them free rein to, amongst others, consume alcohol or drugs while on the clock? Now, companies have been concerned about worker productivity at home, and some people say that working from home actually makes them more productive than going to the office. And they're also concerned that going to the office may put them at risk of contracting the coronavirus. So what are the legalities around all of this? To help us navigate and understand more, I'm joined by Phetheni Nkuna, who's Director at Cliffe Dekker Hofmeyr Employment Practice. Thanks so much for your time and welcome to Morning Live, Ms. Nkuna.
Thank you, Sakina.
So this is a very interesting one, because even if workers are not physically working from the office, the labor laws and company policy, I would imagine, still applies.
Yes, definitely. I mean, from the Occupational Health and Safety Act perspective, the safety regulations, they prescribe that an employee may not attend at the workplace either intoxicated by alcohol or any narcotics effect-causing substance. That would be your drugs or your dagga. That equally applies even when you are working away from the office, that is your physical premises. What is important, though, is for employers to have policies in place and communicate these to avoid any doubt.
So the question then becomes, how does the employer then monitor what is going on and exactly what you are and are not doing at home? How does the employer then get to physically prove that a person is one consuming alcohol or that they are doing drugs while on the job?
Well, it's a bit complex because you don't really have people on webcam 24/7 or necessarily watching every single thing they do. But you do come across symptoms such as low productivity, somebody not delivering on their deliverables, or poor quality of work. And in certain instances, you find excessive absenteeism. Somebody just says, I'm sick, I can't do this, I can't deliver, I cannot attend this meeting. And in unfortunate circumstances, you will actually have employees who attend Zoom meetings, Teams meetings, drunk. So those are some of the symptoms or red flags to look out for. You just need to monitor the deliverables, make sure that everybody checks in. And if you come across or start to be concerned, then you need to look into what is actually causing the change in the employee's performance.
Now, Ms. Nkuna, the reality is this situation of a lot of people working from home wasn't one that either the employer or employees were necessarily deliberating about, trying to find ways and means of making work. It was something that we were all just thrust into. So how do you then go about implementing occupational health and safety regulations if the worker is not present in your building and you didn't necessarily have the time to even work around some of these issues?
I think a considerable amount of time has passed since we all came to be orientated or acquainted with the new work normal. So it's been a couple of months, and I believe that at this point in time, employees and employers ought to have had that conversation to say, listen, these are the options available to you. We are trying, obviously, to reduce presence in offices to try and make sure that less people are exposed and we have less people in the building. You have the option of working from home. Can we then draw up a list? What is available to you? Do you have fiber connection? Do you need a laptop? What is your workspace? How can we support you? And in that conversation, policies and rules are very integral, because just as you start working from home, you need to know the do's and don'ts. And the employer also needs to make it clear that if you do not comply, these are the consequences. And that being said, employers also need to be mindful that there is intoxication as a form of misconduct misconduct, and there's intoxication as a form of illness or incapacity. From either perspective, there are things to be put in place where it's an illness. We have counseling, we have rehabilitation, but obviously that comes with its limitations because an employer is really not in the business of rehabilitating addicts. There needs to be prospect or possibility of rehabilitating somebody and not just flogging a dead horse, so to say.
But as you say, that's not necessarily the primary business of the employer. So what are the rules and regulations regarding that as well?
So the moment as an employer, you pick up that there is a problem, first things first, you need to address it with the employee. Say, listen, this is what we have picked up. Is there a problem? If an employee comes and says, no, I don't have a problem, then you have a misconduct issue, and that needs to be investigated as a form of misconduct. But when an employee says, yes, I have a problem, it has to be a genuine problem. I've had clients who've said, listen, the first thing this person says to me is, I suffer from alcoholism, only to find that it was just an excuse to get out of trouble. So there has to be a genuine problem. Then taking it further, there are employees usually have programs in place to try and counsel the employee, to try and help them, avail to them some sort of medical attention, to try and help them with the problem so that they get back to productivity and performing at the standard that is required by the employer. So it's really a process that is handled in conjunction, employee and employer, with the assistance of your human resources personnel who are usually well versed with these kind of processes and how to handle them.
So again, easier to perhaps try and monitor and even detect some of these behaviors when someone is in the workspace where the employer actually resides. But what are the legalities of monitoring a person's work performance if they are not presently in the place of employment? What can and can't the employer do?
Well, from the monitoring perspective, that is ordinary within the normal course of employment. There has to be defined deliverables. There has to be monitoring, there has to be coaching, there has to be, listen, this is the project, these are the deliverables, this is what I expect. Where there is a decline or unsatisfactory performance, that needs to be evaluated. There has to be a session between the manager, the supervisor, giving feedback and saying, these are my concerns, this is how I believe you can improve. And obviously, there are different factors at play. Sometimes it could be a competence or skills issue. And sometimes it could be an alcoholism or addiction issue. The manager needs to be quite alive to the circumstances and properly evaluate. There is no rule cast in stone on how further or to what extent can you take this. It needs to be a live process of feedback. These are the deliverables. I need this by then. I need this quality of work. And if the employee is not performing, then you are entitled as an employer to look into the reasons why this employee is not performing.
And there does seem to be a debate, Ms. Nkuna, about those who are forced to return to office now on lockdown level 1. Many companies reporting increased cases of coronavirus in the workplace, and many people work in open plan offices where there are sometimes hundreds of people on the same floor. So what are the regulations in terms of engagement onto whether people should be able to return to work or not, given that we have now, in a sense, normalized working from home as a result of this pandemic?
Okay. So really, from just as a point of departure, the working from home is really not to be taken as a right or as an entitlement. It was put in place by most employers to try and mitigate the risks of infections, having a lot of people in the workplaces, and trying to comply with the regulations that have been issued and updated continuously. That being said, Where there are concerns in the workplace, employers are required to have occupational health and safety officers whose primary responsibility is also to ensure that there is compliance with the regulations, that there is social distancing observed, that people have sanitizers, that your open plan space is adequately demarcated, that you have the necessary equipment you need to try and mitigate the risk of exposure as much as you can. Now, where that is not being complied with, then it becomes a concern. But every case needs to be assessed on its own facts, looked at on its own merits as to what is happening. Is the employee's assessment correct, or are they simply trying to find a reason to continue working from home? Likewise, I've come across a lot of clients who actually encourage their employees to work as home as much as they can. But this obviously differs across industries, because you have employees who, by the nature of their job, need as much as possible to be physically present in the office. So it requires an assessment looking at the nature of the business, looking at the setup of the office space, and also assessing whether or not the way the employer has set up its workplaces complies with the COVID-19 regulations.
And what if someone insists, and I know you said in the previous point, as a part of departure, we need to acknowledge that this is not a right for people to work from home. But what if someone insists on staying at home, saying that they are truly scared that they will contract the virus, that they are more productive at home and are afraid to go back to the office? What right does that worker have, especially if, God forbid, something happens and the person is forced to go back to work and they then do contract the coronavirus? Can they sue the employer?
Well, you can't insist based on fear. I know of employers who've had employees who suffer from certain chronic illnesses, who have certain comorbidities, to work from home. That is an exception to try and minimize their exposure as much as possible. To the extent that as an employee, you really would like to continue working from home, I would advise that there is then a platform for a discussion with your employer, your line manager, your supervisor, whoever it is, to say, listen, I would like to continue working from home, and this is how I propose to set up that whole arrangement. Then you come to an understanding that is clear, properly agreed, and that can be monitored, and that you are able to deliver. Because at the end of the day, employers really need employees to deliver so that their business operations are not compromised. And to the extent that there's an alternative which does not hinder their business interest, I see then no reason to just put an outright blanket, no, you can't do this. Obviously, everything needs to be considered within the context in which it appears. If you have genuine reasons, or you can propose a way that really just improves the relationship or does not hinder on your deliverables, then employers can be reasonable in those circumstances. On the suing part, we have the Occupational Health and Safety Act, which covers instances where an employee contracts an illness or has an injury whilst performing their duties. That is covered, and a claim can then be submitted through COIDA. But other than that, you would need to show some extreme negligence on the part of the employer, that they deliberately exposed you, they deliberately failed to put in place measures to try and mitigate the risk of exposure.
Well, and just finally, Ms. Nkuna, as we all acknowledge, this was thrust upon all of us, employers and employees alike, and having to work from home. And at the time, I think everybody realized that they needed to do what needed to be done to just keep the ball rolling. However, at this stage, as you say, several months have now passed. And some of these arrangements seem to remain quite loose. For example, using of the internet, for example, where an employer will just say, oh, so you're not commuting to work, so you can use that money in order to pay for your internet service, for example. Is that correct? Should we not at this point be seeing much more clear guidelines as to how things should unfold?
No, I definitely hear you. And I've come across employers who've proposed that, listen, we don't have an issue with you continuing to work from home, provided that you can provide your own internet connection. You can still use your laptop. Then being said, our infrastructure, that is our technology infrastructure, and the cost of data in our country or the region altogether doesn't make it easy, because it does come at a cost to provide data, especially for the employer. And if that is a cost that they can avoid by having employees come into the office, then it's an option. I mean, businesses are looking to cut costs as much as they can. And if data it becomes an enormous cost, that is something that they will look into. That being said, there are employers, who've elected to provide, suppose, let's say 10 gigs. And if you use anything above that, it becomes at your own cost. It is not an entitlement. Unfortunately, a lot of employers didn't foresee that at some point, the provision of data could become a tool of trade, so to say, and it could be needed for an employee to perform their duty. What they've done is provide your ordinary connection in the workspace. Outside of that, unfortunately, there was no foresight. So it's really a continuing process, and employers are figuring that out. I've come across employers who are gradually trying to work around it, provided up to a certain extent. There's also the risk of providing data and having employees abuse it, stream non-related work content, and all of those things. So I believe that as time goes on, employers will have a much more firmer hand at this and come with policies and rules that will be much more accommodative, much more flexible, and will try and meet employees at a point of compromise, so to say.
Well, we're going to have to leave it there. Thank you so much for your time this morning. Phetheni Nkuna, who is the director at Cliffe Dekker Hofmeyr Employment Practice, talking to us about consumption of alcohol and drugs at home while you're supposed to be working, amongst other things. We also discuss fears of going back to the office and your rights in this regard. So that's where we're going to leave that one. And let's quickly run through a few